Hey, future healthcare heroes. Welcome to a journey like no other. Today we're setting sail on an exciting adventure, unveiling the Chronicles of Nursing School. Have you ever pondered over what it truly takes to don that nursing cap? Well, you're about to find out. This series is your golden ticket, offering a behind-the-scenes look at the highs, lows, and unexpected moments that paint the colorful canvas of a nursing student's life. You won't want to miss a beat of this roller coaster ride. So what are you waiting for? Hit that subscribe button, fasten your seatbelts, and gear up to delve into the mesmerizing world of nursing school with me. Together, we'll navigate through the chaos and the rewards, the tears and the triumphs, the study nights and the clinical days. So buckle up and get ready to uncover the captivating world of nursing school with me. Ever wondered what a day in the life of a nursing student looks like? Well, wonder no more. Let's embark on this journey together, from the break of dawn to the twilight hours. It all starts with the alarm clock's relentless call. Rise and shine because the early bird catches the worm, right? Nursing school is no different. Morning lectures kickstart the day, brimming with knowledge, insights, and plenty of note-taking. These lectures range from anatomy to pharmacology, each as fascinating as the next. Just when you think it's time for a breather, the day's momentum picks up. Cue in the practical labs where theory meets practice. Here we get our hands dirty, quite literally sometimes, learning to perfect skills like drawing blood or dressing wounds. It's a safe space for trial and error, a place where learning from mistakes is just as important as getting things right the first time. Post-lunch, it's time for the highlight of the day. Clinical rotations. This is where the magic truly happens. We trade our textbooks for stethoscopes, our lecture halls for hospital corridors. It's challenging, no doubt, but also the most rewarding part of the day. The privilege of interacting with patients, understanding their stories, and playing a role, however small in their journey to recovery, is nothing short of humbling. The day doesn't end with the clinical shift, though. Evenings are reserved for unwinding, reflecting on the day, and yes, a healthy dose of studying. After all, nursing school is a marathon, not a sprint. And like any good marathon runner, we know the importance of pacing ourselves, of maintaining a steady rhythm amidst the chaos. Finally, it's lights out, a moment of quiet after a whirlwind of a day. But as we drift to sleep, there's a sense of satisfaction, a feeling that we're one step closer to our dreams, one day closer to becoming the healthcare heroes we aspire to be. You've just witnessed a typical day in the life of a nursing student. Yes, it's intense, but it's also incredibly rewarding. Each day is a new chapter in our nursing journey, filled with challenges, triumphs, and plenty of learning, and we wouldn't have it any other way. Studying in nursing school can be intense, but fear not. There's no need to pull an all-nighter before every exam or spend every waking moment glued to your textbooks. It's all about finding the right strategies that work for you, and that's exactly what we will be discussing in this segment. Firstly, let's talk about active learning. This is all about engaging with the material, not just passively reading it. Try summarizing information in your own words, teaching it to someone else, or even creating mind maps to visualize the concepts. This way, you're not just memorizing the material, but truly understanding it. Next, consider using mnemonic devices. These are techniques that help you remember information by associating it with easy-to-remember constructs. For instance, you can use acronyms, visual imagery, or rhymes to help remember complex medical terms or processes. Another tip is to break your study sessions into manageable chunks. This technique, known as the Pomodoro technique, involves studying for a set amount of time, say 25 minutes, followed by a 5-minute break. This can help maintain your focus and prevent burnout. But what about those hefty textbooks and endless lectures? One approach is to use the SQ3R method, which stands for survey, question, read, recite, and review. Firstly, survey the material to get a general idea of the content. Then, formulate questions about what you want to learn. Read the material, recite the information, and finally, review what you've learned. This method can help enhance your comprehension and retention of the material. Lastly, don't forget the importance of self-care. Regular exercise, a balanced diet, and adequate sleep can significantly impact your ability to concentrate and retain information. So, make sure to take care of yourself amidst the hustle and bustle of nursing school. Remember, it's not just about studying hard, it's about studying smart. Find what works best for you and stick to it. Happy studying, future healthcare heroes. Now let's dive into the real-deal clinical rotations. This is where the theory from textbooks meets the reality of patient care. It's the time when nursing students transition from the safe environment of the classroom to the bustling, unpredictable world of healthcare. Clinical rotations are a whirlwind of experiences. One moment you're assisting with a routine checkup, the next you're in the thick of an emergency. You're constantly on your toes, adapting to new situations, learning to navigate through different departments, and getting a taste of various specialties. The rotation is more than just shadowing experienced nurses or doctors. It's about laying hands on the job, performing tasks under supervision, and gradually gaining confidence. It's about learning to communicate effectively with patients, understanding their concerns, and providing comfort in their moments of vulnerability. But let's be honest, it's not always smooth sailing. The early morning shifts, the unexpected emergencies, the emotional toll of witnessing pain and suffering, it can be daunting. There are moments of self-doubt, moments when you question whether you're cut out for this. And yet, amidst these challenges, there are moments of profound joy and satisfaction. The grateful smile of a patient, the relief in their eyes when their pain subsides, the heartfelt thank you from their loved ones. These are the moments that make it all worthwhile. Clinical rotations are where you see the impact of your work firsthand. You realize the power of empathy, the importance of patience, and the value of resilience. It's where you learn to balance compassion with professionalism, to handle pressure with grace, and to make critical decisions with confidence. And most importantly, clinical rotations are where you truly understand the essence of nursing. It's not just about administering medication or charting patient records. It's about caring, about making a difference in people's lives, about being there in their times of need. Clinical rotations are challenging, but they're also where the real learning happens. They shape you, mold you, and prepare you to face the realities of the nursing profession. And in the end, they make you realize that every hurdle, every struggle, is worth it for the privilege of serving as a nurse. Balancing nursing school with work and life outside the classroom can be a juggling act. Indeed, nursing school is demanding, and life doesn't hit pause when you hit the books. It's all about finding the right balance. And today, I'll share some strategies that have worked for me. Firstly, time management is crucial. Prioritize your tasks, use a planner or digital calendar, and stick to your schedule. Secondly, don't be afraid to say no. It's easy to overcommit, but remember, you can't do it all. Thirdly, take care of your physical and mental health. Regular exercise, a healthy diet, and adequate sleep can do wonders for your energy levels and stress management. Lastly, find time for relaxation and hobbies. Whether it's reading a book, going for a walk, or catching up with friends, these moments of me time are essential to recharge and keep burnout at bay. Remember, balance is key, and don't forget to take some time for yourself. I asked you on social media for your burning questions about nursing school, and today I'm answering them. So, let's jump right in. One of the most common questions I received was, how do you handle stress? Well, it's all about balance. I make sure to incorporate relaxation techniques like yoga and meditation into my daily routine. Another question was, what's your favorite clinical experience? That's a tough one, but I'd have to say my time in the pediatric ward. It was challenging, but the resilience of those kids was truly inspiring. And to the question, what's the hardest part about nursing school? I'd say it's maintaining focus during those long study sessions. But remember, it's about progress, not perfection. That's all the time we have for today's Q&A. I hope this gave you some useful insights into the world of nursing school. If you have more questions, drop them in the comments for the next Q&A session. As we wrap up this first episode, I'm thrilled to have you on this journey with me. We've just scratched the surface of what it's like to walk the path of a nursing student. The late-night study sessions, the exhilarating clinical rotations, the juggle of school, work, and life. It's all a part of this remarkable voyage, and there's so much more to come. In the episodes ahead, we'll delve deeper into the world of nursing school, the challenges, the triumphs, and the unexpected moments that make it all worthwhile. If you're a fellow nursing student, I can't wait to hear about your experiences. Share your stories in the comments. Your insights could be the encouragement someone else needs. For those here to learn, welcome aboard. Your curiosity is what drives this series. Don't forget to hit the like button and subscribe for more. Until then, take care and keep aspiring to make a difference in healthcare. See you next time.